Hello. Good afternoon. My name is Jessie Higgins. I'm the Chief Mental Health Officer for the City of San Antonio, and I'm so excited to bring this panel of experts to you. This panel, we're going to address navigating youth mental health crisis services, and I just want to thank everyone for coming out. This is a group of people who is extremely dedicated, knowledgeable, and really passionate about the kids that we're serving and the safety of our community, and recognizing that anytime that we work with children, whether they're in the beginning struggles of mental health or whether they're in the throes of a crisis with mental health, that it is upstream work and it's an investment in those children's future, in strengthening those families. And I think the panel today is really going to be able to address any questions that you may have. The point of these workshops that we have today, we did youth mental health services first. After this, we're going to do youth substance use services. The point is really so that you can walk away with more knowledge and more wisdom, so that if you have kids in your life, in your workplace, in your home, in your church, in your communities who are struggling in their mental health and maybe in crisis, that you have a better understanding of what happens. We know really well when we see a car accident, around us on the freeway. We know what's going to happen when we call 911. We know really well what's going to happen when someone around us is having a medical emergency, a heart attack or something like that. We know what's going to happen when we call 911. We don't always have a good understanding of what should happen when we call 911 for a mental health emergency, and especially for something that's going on with someone under the age of 18. And I hope today that you understand more of the concrete information that happens when that may happen with you, and also more of the systemic infrastructure that we have set up around 911, youth mental health crisis, and mental health crisis in general. And so that's just a little intro. I do want to point out that tomorrow on Saturday, we do have some sessions that are meant for you to bring young people in your lives. We're hoping that more people, today, I hope they're in school, but we're hoping that more people who are younger are able to come on Saturday and attend some of those sessions that are for the whole family. One note about CEUs is that we do have a survey. We'll have a QR code. I am aware that the QR code looks like it's asking you about the entire conference. I have checked in with that. You can either fill it out multiple times if you aren't sure which sessions you're going to, or you can fill it out once if you know what sessions you're going to. So that's up to you. It's up to your preference. And we'll be back in touch with you through the Whova app to get you your CEUs. So that will be at the end. So let me go ahead and introduce our panel, and then we'll get started. Jennifer C. is a licensed professional counselor and a licensed chemical dependency counselor. She is the clinic administrator at the Center for Healthcare Services Crisis Response Services. Prior to her current position, she was the mental health clinical trainer for HEB and in private practice in Stone Oak, where she worked with tweens, teens, and adults with substance use disorders. Lieutenant Paul Castillon is the director of the mental health unit at the San Antonio Police Department. He's been with SAPD for 18 years and has worked on units that include patrol, special victims unit, financial crimes, and the Southwest Texas Fusion Center. Lieutenant Castillon is a graduate of Texas A&M University and has been the director of the SAPD mental health unit since 2021. Dr. Jeannine von Stultz is the deputy chief of the mental health services division for Bexar County Juvenile Probation and is a licensed psychologist. She provides administrative oversight for the probation supervision of specialized populations, including juveniles with mental health needs, substance use difficulties, sexual offense histories, as well as those juveniles who require residential treatment. Dr. von Stultz also identifies, develops, and coordinates the provision of community-based mental health services within the department. And Jessica Knudsen is the CEO and president of Clarity Child Guidance Center. Since joining Clarity in 2019, she has successfully guided the nonprofit organization through the alarming negative effects in children's social development, academic development, and emotional health due to the pandemic, which caused an equally alarming need for Clarity's services. Because of the ever-rising needs of its 8,000 children served annually, Jessica is now guiding Clarity through an expansion of beds and facilities for its hospital and crisis assessment services unit, offering specialized inpatient and outpatient treatment for children. Jessica is a Texas Hospital Association Leadership Fellow and a member of Leadership at San Antonio, class of 46. She received a Master of Science in Social Work from the University of Texas at Austin. Ooh, we have a UTA and I'm thinking, I hope y'all can act right. And a Bachelor of Science in Psychology from University of North Carolina at Chapel Hill. Thank you all for being here today. And I'm going to go ahead and hand it over to Jennifer, who can kick us off.
Good afternoon and welcome. So I'm really excited to talk about our mobile crisis outreach teams. So as Jessie said, I work with the Center for Healthcare Services, and a lot of times, like she said, people don't know where to go when somebody's having a crisis, especially our children. Do you call 911 and what do you say to a police officer? And are they really the appropriate person always to come if somebody's having a crisis? So who do you call for mental health help? Well, we do have a really great 988 suicide and crisis hotline right now, which is also textable. And so I think that came into play about 2 years ago. You can also call information in this city. Actually, somebody came up to Lieutenant and was asking some information. I said, hey, you can call 211 and they can give you maybe some information about where to go or some resources or things like that, and that's available 24 hours a day. But if you're having a mental health crisis, there is a crisis hotline that we have through our Center for Healthcare Services. We don't actually run the crisis health line. It is run through a third-party unit called Avail. They're actually out of Corpus Christi. But you can call 210-223-SAFE, which is 7233. So everybody should program that into your phones if you are parents or you have children in your life that you care about or you're a teacher, educator. And you can call that and a team can come out to you. One of our teams can actually come to wherever you're at, your school, your home. If you are at a mall or you are at a movie theater and your child is having a crisis, we will show up and help and do an assessment. So what are the crisis response teams? We have a mobile crisis outreach team. We are comprised of 5 assessors and a supervisor, and we provide face-to-face crisis assessments, because another thing too is that sometimes maybe talking to somebody over the phone, while that's a great modality, sometimes kind of seeing what is actually going on in person, we can't always see what's happening with body language. We can't always see what's happening, maybe they haven't showered for 3 or 4 weeks and they don't smell great. And some of those kind of maybe signs that somebody's in crisis are going to be a lot easier when we're in person. And also it's a little bit more comfortable if somebody just kind of comes out, they're dressed very casually, and they're just like, hey, we just want to have a conversation, ask you a few questions, find out what's going on. So we have 2 different teams. We have an adult team, which is our mobile crisis outreach team. That is for adults 18 plus. We have a children's mobile outreach team, which is also, these are both available 24 hours a day, 7 days a week. And that's for children up to age 17. We typically, trying to think, somebody asked me one time how young we come out and assess. I think one of the youngest we did was 3 or 4 years old. So kind of hard to assess a 1-year-old. So probably wouldn't come out for that. But why do we have these teams? So these teams are really qualified mental health professionals. Everybody on our teams has to have a master's degree. Some are licensed, that's not a full requirement, but they are qualified mental health professionals recognized by the state of Texas, and that requires a master's degree in counseling or social work, and available to know all the things they need to know about crisis and mental health. We also will go out and also maybe it's a crisis that can be resolved on the scene and we can give resources or give people some referrals to places that they might need counseling or area resources as well. So what are the benefits of these teams? There are a lot of benefits, and why were these teams even created? Well, these teams were created for a lot of reasons, to help people, because sometimes maybe a mom doesn't have a car, or maybe you are just somewhere where your child is refusing to get in the car with you and go get the help that they need. So these teams were really kind of created to take away some of those barriers. Maybe it's 12 at night and you really don't know where to go, you have children sleeping, or you just can't leave your home for whatever reason, you're taking care of somebody that's ill in the home. They reduce cost, because we don't always want to have people run to ERs. And the ER is kind of the highest level of care, and it's going to be the most, we don't want to get a very, very big ER bill. I know I don't. If there was just something that my child just needed a resource, or we just needed just some information that I just didn't know about, and I don't want to get a $4,000 hospital bill for that. We provide education. Our teams are very, very versed in area resources, referrals, where to go, what to do. If you find drugs in your child's room, or your child is saying that they want to kill themselves or they want to kill their pet, or they want to kill you. What are you supposed to do with that? And a lot of people, this happens sometimes, seemingly out of the blue, and people really don't know what to do with that. And also sometimes people are a little bit embarrassed. There's some shame and stigma that goes along with mental health, and so that kind of takes away some of those barriers as well. You can have somebody come into your home, do an assessment in the comfort of their home. It's a little bit less intimidating also than maybe going to a hospital or talking to somebody else in a facility. We give safety plans too. We leave to everybody, even if it's resolved on scene or not, we're gonna leave you with a safety plan that also includes resources and maybe what to do next time this happens. Because sometimes this is maybe not a one-off occasion. And these are the goals of our MCOT and CMOT. So these are the Texas Health and Human Services. So every LMHA in any city is required to have a mobile crisis outreach team. So even in rural areas, they will have these. We are very, very fortunate because we have a very big, robust team. And in rural counties, sometimes they're covering a lot of counties. We only cover Bear, just FYI. But these are just some of the goals. We want to make sure that we're resolving the crisis on scene. We want to make sure that we are getting people to the appropriate level of care that they need. They might not need to go to a hospital. They might need to go get some substance use treatment. Or they just might need something else that, we just don't know what it is until we're having that conversation. So we do a very, very full, thorough crisis assessment. We look for different risk factors that, might stand out to us, because sometimes, again, there's some nonverbal cues and there's some other things that we can ask and find out. We want to stabilize people in the least restrictive environment. Anybody who has middle schoolers know that, they don't like to be told what to do, right? Definitely having maybe somebody else come in other than mom or dad or aunt or whoever also is a lot easier. And we want to divert from emergency rooms or jail whenever possible, because just because somebody's having a mental decomp doesn't mean that they need to be punished and go to jail. They just might need some some further help, some medication, some connections to services. So what happens when you call the crisis line? So it comes into our crisis line. We do kind of a brief assessment on the phone just to make sure and see what is kind of, immediate going on. If there's any medical issues, our MCOT team is not going to be the appropriate team, but our crisis line will route it to a team that would come out. We also have other teams that I think LT is going to be talking about that have a medical component. And then calls are dispatched based on the disposition. So if a call comes in, it's going to be either if it's an adult, go to our MCOT team. If it's a child, it's going to go to our children's team. Our field responders are going to get that call, and we are going to just jump into action. Emergent calls have to be responded to in 1 hour, and other calls have to be responded to within 8 hours. But I can guarantee you, we don't take 8 hours to respond to a call. My team might get in a little bit of trouble if they take 8 hours. So we have people ready to go. We're usually on scene, if not within an hour, probably within 2. Officer role, and I know that Lieutenant is going to go into a little bit more about, just the police officer role, but why would we bring a police officer? Why don't we just bring a clinician? Well, there's certain times where we might need a safety component. So, our people are 24/7. They are going out. If we get a call at 3 in the morning, they need to jump in the car and get out and go at 3 in the morning. And sometimes, depending on the situation, and especially depending on the disposition of the person, might not be just safe for somebody to go into someone's home. And again, depending on maybe what's going on in the situation. Maybe there's a ton of dogs and they don't want to go in the home and the people won't come out of the home. In certain situations, we're going to call for a police backup in that instance. It's not to be punitive, it's just maybe to have the police there. They're going to secure the scene, they're going to look around, make sure the scene is safe for our clinician, and that the scene is also safe for the person that we are coming to assess. And if there is something else going on, the police will handle that. We are not a police officer, so that's not our job. We leave that to the pros. But also there are times when maybe somebody needs to be emergency detained. Maybe we know that this person is very suicidal. They do have a plan, but they are refusing to go to the hospital. In cases of minors, we can force them to go, but if you are 24 years old or you are 30 years old, we have this thing called free will. But if we determine that you are a threat or a safety to yourself or other people, we will get the police involved, they will do an emergency detention, and you will be taken involuntarily to a facility. And it's just for everybody's safety and security. So again, our clinician role is just to we try and really resolve on scene or de-escalate when appropriate. It's not always going to be appropriate to resolve on scene, and again, our people know when to stay on scene and when maybe it's time to go to a higher level of care. And really, I think the connection to resources and services is such an important component of all of our teams that respond to crisis in the field. But again, safety is a priority. That is why we have, great police, and we have a great relationship with the police, and we have police backup when and if we need it. And, also for the consumers that we serve. It's just really, really important to me. If there's ever a time when one of my clinicians is like, hey, I'm just kind of feeling kind of a certain way about this call, I don't know what to put my finger on it, I said, call the police, and that's what they're there for, and they'll always back us up. With the center, these are, might want to take a screenshot of this. This is really important. So with the center, we have some great services, not only field teams, but we do have 2 walk-in crisis care clinics for children. But these are only open during the week. So these are not open on the weekend, not open 24 hours, but our response clinicians are based out of these clinics. So if you wanted to take one of your children to one of these clinics, you can walk in. You don't even need to call or make an appointment. These are walk-in, and we will see people, as they come in. But after hours as well, you would call that crisis hotline number, and that's how one of our clinicians would come out to you in the field. We also have an adult crisis care center. It's on 601 Frio, and that is open 24 hours a day, but that is for adults. And we also, in that crisis care center, there is an extended observation unit where we do have psychiatric beds, so we can keep people overnight, do a little bit more thorough assessment, so on and so forth. So I think we're going to leave questions till the end. Again, here is the Center for Healthcare Services. That's our intake line and also our crisis line. Again, when I was in private practice, I always made people put this in their phones. That was one of the caveats of coming to see me, because I just think this crisis line is a really, really great service that we offer. And there's my information if you wanted to just kind of contact me or email me for any questions or concerns. Thank you.
So, Jennifer, I actually have a couple of questions for you before we transition to Lieutenant. What would you tell families or adults are the signs that their kiddo might be in crisis? And there's a mic right there, if you want to grab it.
Is this on?
Yeah. Okay. It's ready for you.
Oh, great. Well, sometimes they can be they're not always so obvious. Sometimes they can be very subtle. Things that I would really look for, drastic changes in appearance, drastic changes in weight, either gain or loss of interest in things that they've really liked, if they were playing a sport and then they just decided to quit it, if they change groups of friends, if they're spending a lot of time alone and spending a lot of time online and you don't really know, and they won't really tell you what they're doing. So I think those are probably some of the very, very big, and especially with school starting, changes in grades and loss of interest in maybe even going to school and being around other people, and always looking for signs of isolation. I think we all need our alone time, and kids especially need alone time, but I think there's a big, big difference between isolation and being alone. So again, they don't want to come down to family dinners, they don't want to go on vacations, they don't want to play with the pets that they've loved, sleeping a lot. That's a big one too.
Thank you for that. I just think that's we're kind of talking about the how. I want us to talk about understand the why, why do we need these services at sometimes in people's lives? So thank you for that.
Absolutely, thank you.
Lieutenant, you ready?
Okay, again, thank you for attending today. My name is Paul Castillon, and I am the director of the SAPD Mental Health Unit. So I appreciate you coming today to the talk to learn more about what we are doing as a department to address the ongoing needs of the community, and in particular, the youth. So we certainly recognize that we are very fortunate to be in a community where there are lots of resources and a lot of things that we can offer that are out there, and not every situation requires a police officer. So the majority of these incidents can be resolved with other resources that are in our community. I know she just provided a lot of different phone numbers and other different avenues to go. But we also do recognize the important role that we as law enforcement do play in how the landscape and the environment of the mental health current system is in place. And so every time our officers go out there, they play a very important role in how they interact and how they communicate with not only the person who's experiencing the crisis, but with the family and with everyone else involved. And so what we have been really trying to emphasize through our trainings on the department is just how important those interactions are, and how just being compassionate in our response can not only affect having a positive outcome of that particular situation, but also for future interactions with other law enforcement. So it's very important. Our officers are out there. There's a lot of calls, and speaking to officers, they talk about how prevalent these type of calls how common they've become here in recent years. There's just been a growing impact on the community, and the officers out there are recognizing that. So with San Antonio Police Department, our guiding principles are fairness, respect, integrity, and compassion. And so those apply to a lot of different things, pretty much everything that we do as a department. But when I think about those, I think they're particularly important when it comes to our interactions with the mental health community. So that's how important it is for us. So one of the first things I want to do is kind of explain the process of, I know we talked about some of the other phone numbers, other resources out there that you can call, but I want to explain the process of it when you do call SAPD for assistance for some type of mental health crisis. What is our response going to be? What is that going to look like? And what are kind of some of the different ways we might respond to that particular situation? So the first thing, first type of response, well, before I get to that, I'll go ahead and kind of go over the different phone numbers. First of all, if you are in any type of emergency situation, you are in danger, you need an officer to you as soon as possible, 911 is your number, as we all know. I know there's just a lot of phone numbers out there, but we have seen situations where people try another phone call in an emergency situation, but it's a priority for us to get out there and make sure that the scene is safe for everyone involved. So any type of emergency, make sure you utilize that 911. If it's a less urgent matter, our non-emergency number is up there. It's 207 SAPD, so it's a little easier to remember than the 7273. But that's going to be for any type of non-emergent situation where you do need an officer to go out, maybe assist a patient who's maybe already in a clinic. The scene is fairly stabilized, but you do need an officer out there. And then the next number right there is going to be the mental health unit. That's going to be our office. They're at Public Safety Headquarters. We're there if you have any type of questions. I know we have Center for Healthcare Services clinicians there in our office. So sometimes when we get general questions about what resources are out there and what we need to do, we can coordinate and answer some of the more general questions. But please don't call us if you need an officer actually out at your location. But that is another phone number that I wanted to share with you. So when you do call, whether it's 911 or the 207 SAPD number, the call takers and the dispatchers are going to ask you some very specific questions, because what we're trying to do is get an accurate picture of what's going on at your location. That's going to allow us to make sure that we send the proper response to you, and we know how urgent the situation is. Some of the questions that they're going to ask is they're going to ask if there's weapons at the scene. They're going to ask about violence that may be ongoing, but they're also going to ask about known diagnosis and whether that child or that person who is suffering that mental health crisis, if they're currently medicine compliant. That way we can start gauging and we can start consulting with some of our multidisciplinary teams to see if they're going to be going out there. So answering those questions is very important and making sure we get the right response. So when SAPD does respond to mental health related calls for service, you're going to see one of three different type of responses. First is going to be our SA Core, which is the multidisciplinary team, where it's going to be 3 members. It's going to be a mental health unit police officer. It's going to be a Center for Healthcare Services crisis response clinician, and then the third member is going to be a San Antonio Fire Department MIH paramedic. So we're going to really be able to provide that a lot of different resources and a lot of different points of view as we respond out there. We'll be able to really address any type of need for that particular situation. And that team has been around since 2022, and we're excited about the recent growth and expansion. They've recently gone 24 hours per day and also providing services citywide. So the second type of response that we might have would be one of our mental health unit response teams. Those are going to be plainclothes officers who, again, are full-time members of the mental health unit who are responding and handling calls. MHU officers, we're very fortunate to have a growing team, but these are officers who are very passionate about this particular cause, and they want to provide a good compassionate care and really handle these calls the best way possible. So we're happy to have those teams out there. And then the third response that you might see is going to be patrol response, and that they're going to be needed for numerous different type of reasons. One, they're usually going to be the closest to you in any type of urgent situation, but also if there's any violence or weapons, they're going to be the best equipped to be able to handle that type of emergency situation. So they're definitely going to need to play a part in that role. Okay, so looking at where we are as a department, it's last couple years we've had over 30,000 calls where mental health was the primary reason for SAPD responding to that location. And so what we've done as a department, we've implemented several different changes. One is we've had rapid expansion in our mental health unit, where we have more of those MHU officers out there being able to respond. We've also initiated several different programs where we're prioritizing different things, such as making sure that all of our officers are properly trained, making sure that we have different programs where we're partnering with Center for Healthcare Services, with the San Antonio Fire Department, so we can bring in those different perspectives in our handling of the call. So when we go out there, we're trying to balance a lot of different things. A lot of times they're very dynamic scenes, so we want to make sure that we're addressing the immediate need, but we're also balancing that with trying to provide a compassionate response, but also ensuring the safety for everyone involved. So it's really important for all of our officers on the department to be trained in proper responses, and that's why we've done some of the things that we've done with our expanded training, just because our response teams, we love SA Corps, we love our MHU response teams, but at the end of the day, this is a lot of calls, and patrol is going to have to be able to go out there and handle a lot of them. So some of the training that we have implemented is our last year we started training a CIT 2.0 is what we call it, but it's a custom course where we're training our officers on. We're reinforcing the principles of crisis intervention training, but also we're bringing in a lot of the resource providers that are local and here in the San Antonio community. And we're already hearing success stories about officers who are going through that 40-hour class. They're going back out there in the field. They're contacting these resource providers directly, and resources that they had no idea even existed, but we're connecting those patrol officers and those resources. So we're very happy with where we are in our training, especially with the CIT 2.0. So some of the additional programs that we do implement, I know I just talked about the CIT. Talked about SA Corps also a little bit, but for those who haven't seen it, this is what an SA Corps team looks like. As you can see, they're all in the plain SA Corps polo shirts. They go out there. It really sets a different scene when they first respond. It's a lot different than if I show up looking like this. You're going to have these three. They're going to show up. They're going to introduce themselves different, and it's going to change that particular interaction. So we're really happy with how the SA Corps teams have done and the support that we've had from the city as we expand. So some of the other things that we're doing is we also have a program called MAPS, where we accept referrals from different areas, and there are a lot of children who end up being referred to us, whether that's from patrol or working with our schools, some of the different things. And we'll go out there with our clinician and an officer, and they'll try to build that relationship. And we're trying to connect that child to whatever resource is out there that can help them solve their problems long term. So the next one up there is the Public Safety Threat Assessment Group. This one is particularly important when it comes to youth because school threats have become such a major problem, nationwide. But in particular here, those threats have to be taken extremely seriously on the front end. We have to make sure we address it. We keep everybody safe in the schools, but at the same time, there's a good number of them that are originating from children who are in those schools. We run into a lot of situations where those kids are, it's an outcry for help. Maybe there's some other things going on in their life. So once we've been able to address that initial threat and determine that we've got the proper mitigations in place, that there's no more threat to the school or the location, then we can start to address the individual. So, what's truly going on with them? How can we try to get them connected with proper services? We've had a lot of success stories where the child was doing it for that reason, for an outcry for attention. Time has gone on. They've gotten the services that they've needed. And now they're great kids, no longer deemed any kind of threat, and things have really stabilized for them. So that's a program that we're very proud to take part in. Then we talked about our response teams, and then also law enforcement navigation, which is very important, I think, when dealing with youth, because we work with STRAC to make sure that anytime we have to do an emergency detention, we are taking that child to the proper facility where they can get the proper care. And the law enforcement navigation system helps us in making sure that we do that. Real quick, I'll just go ahead and finish up with a quick story that one of my officers told me not too long ago. It actually started out with one of our SA Corps teams, and they went out there, they were visiting a 14-year-old girl on the north side. She was in a really, really bad place. She was sharing a lot of the trauma that she had been through in her life. She was now having suicidal ideations. She was in a really bad place. So they ended up doing the emergency detention that night. They took her to the facility, turned her over to staff there. It was, they finished all their paperwork. They went on to the next call, but they felt good that they at least got her. They intervened before she did anything, got her to a facility. So a couple weeks later, the officers again at the same facility, and who does he run into? He runs into her. She comes running up, gives him a big hug. She's in a much, much better place now. She thanked them so much, said the team, she really felt the team saved her life that night. And he was really proud to share that story with me, but I share it with y'all for two reasons. I think one is stuff like that validates the work that our officers are doing. They're very passionate about what they're doing out there, and that was very rewarding for them. And second, I think it shows the importance of all of us. We all have a role in helping the people in our community and the children in our community. The officer, the medic, and the clinic, they were out there that night on scene to make sure that she got to the right facility. Once at the right facility, they made sure that she was connected with continuing services. And then in the end, it really made an impact on that one particular individual. And those type of stories are always great to hear. And so it really validates the things that we're doing. So thank you all again for being here today, and we'll be available afterwards for questions.
Absolutely. Thank you so much, Lieutenant. And I know that you're a proud dad, and I could kind of feel some of that dad energy in that story as well. I just want to talk about this data slide for a second. And I work at the city, I work closely with the police and medics and with these teams. And I want us to look at this, and I think this can feel really staggering and really overwhelming that there's been such a sharp increase. I'm sure if we went back 10 years, we're probably at double with more than 30,000 911 mental health calls. But, and while I can hold that to be true, I also can hold another thing to be true, that I believe that this has come from destigmatizing mental health, and that people are more comfortable reaching out for help. And I know that not everyone will always feel comfortable calling 911. That's why we continue to build out other service lines, support what the Center for Healthcare Services does with their crisis line. We want to strengthen 988 so that it's the best it can be as well. But this to me shows that people are more comfortable reaching out and asking for help, and that's part of the reason why the number has increased. We are on track this year to stay pretty steady around this 30,000 call mark, which also is hopeful to me that we would have 3 years of sort of stable call volume. And then that allows us at the city and with our supporting partners to actually build out the programs that our community needs. So I know this slide can be really overwhelming and a little bit scary, but I think it's also the work that we're all dedicated to doing so that people feel more comfortable asking for help. And I hope that people feel confident that if they call us at the city through 911 or through other services, that we can provide the compassionate care that they need. And that's something that we take very seriously and that we work on every single day, making these programs better for you guys in the community. So just wanted to say that and acknowledge sort of the impact of this slide. So I'll turn it over to Dr. von Stultz, and she's going to talk about CIT training in schools.
Yeah, and I'm going to choose to stay here if that's okay with you guys. So, but I really appreciate this opportunity. It's actually nice to see some familiar faces. What SAPD is doing in regards to training their police officers, we know that they're not the only ones that encounter young people, right? We see often that young people are struggling with mental health crisis when they're in the middle of school. And so we wanted to make sure that other agencies, other first responders also were able to recognize and understand when a young person was in a mental health crisis and know what to do at that point. And while we've seen kind of a huge uptick in crises since the pandemic, we have known this to be an issue since, before, decades before. And so I wanted to highlight for you the children's crisis intervention training. One of the beautiful things that this is a free training to first responders. It can be fire, police, it can be school district police, surrounding counties. We've opened this up to everybody. And we've based it off of the crisis intervention training that's been known nationally. But we modified it to focus on specifically on the diagnoses of children, how children present when they have mental health struggles, and the resources that are available in our community. The beautiful part for officers is not only are they getting all of this information, but this particular training is something that's required from them if they want to advance. And so we were able to modify it, yet still give them the credit that they need. And I am from juvenile probation, but this is not a juvenile probation effort. This is a community-wide effort. Up on the screen, you see several different agencies that were part of the training this year. SAPD was an active participant. Northside Independent School District, Northeast Independent School District, SAISD, Southwest ISD. We have people that sponsor. Are we doing a whoop whoop for a school district? All right. So we have community providers that sponsor the lunches so that the first responders don't have to take the time and get off campus. We have young people that volunteer to be role players because you can practice on an adult, it's not the same, right? If you want to be able to de-escalate a young person, try to do that with a 10-year-old that is in the midst of a crisis. And we have young people that do that. And so it's been a pretty profound training that I kind of wanted to talk a little bit more about. We began this in 2008. So it's been a long time. Like I said, this is pre-pandemic, all volunteer. We have trained since 2008 over 1,600 different first responders. They know they're able to recognize when a child is having a crisis. They are able to use skills on how to de-escalate that situation, how to encourage that young person to, leave the classroom or to get off the roof or to, get out of the bathroom and to go to the counselor's office. It's a really powerful kind of experience. We only offer this course during the summer because if you think about it, could a school district police officer leave campus for a week during the school year? There's no way. So we offer this course in June and July every summer. And we see people that attend this class. This year we had Texas Parks and Wildlife deputy attend. We've had airport police, we've had transit police, and again, like I said, we've had several school district police. When we talk about the actual training itself, what we do is there's just basic information on the different mental health diagnoses, help them understand what does ADHD look like in a child, help them understand what depression looks like in a child. We help them learn how to de-escalate. They practice what we call the LEAP skills. You'll see it on here in regards to listen, empathize, ask more questions. It's not like, you're not going to kill yourself, are you? I mean, those aren't the questions that they're asking, right? They're very thoughtful in regards to their approach. We do have them learn how to do an emergency detention for a young person. Just so that everyone knows, an emergency detention does not mean a child goes to detention. It means they go to a psychiatric facility. I know it's a weird phrasing, but that's the language behind it. There's a huge resource fair where this year we had 20 plus vendors come to kind of explain the services that they have. Of course, pass out swag, because you got to have swag, just like you do in this hallway down here. But it's a way for them to connect to these agencies, and we see them directly refer children to these programs. And like I said, then there's that daily role playing. I have to admit, when we first started, we had a hard time finding role players, and my daughter was one of the role players when we first started. And she was 10 at the time. And all she did was tear paper, right? She tore paper and kind of was, the officer was like, can you please stop doing that? Why do you care, is what she'd say. Or, what are you gonna do, make me? She would do all that stuff. And this is day one. That officer got so upset with her that he ripped the notebook paper out of her hand, right? The notebook, which with the wires and everything. And I'm sitting there, he's in front of his peers. He ripped it out of her hand, and he was like, she's wasting my time. This is a frustration. She's just being a brat, is kind of the term he used. This officer went through this training. On the last day, he unfortunately drew my daughter again as his role play. He did an amazing job. He noticed, like, she had a certain t-shirt on. Hey, I see you've got, I can't remember what it was. I think it was Yu-Gi-Oh. Do you really like Yu-Gi-Oh? I have a hard time understanding that game. Can you explain it to me? And he was able to de-escalate. And what he said afterwards is, he's like, I realize it's actually less time for me to do this. I'm less stressed. They're less stressed. I don't have to put hands on her. All of these things. And so that's the power of crisis intervention training, and that's the power of this community. You live in a community where people are volunteering their time to do this, going above and beyond. And the final thing I really want to highlight really quickly is we also recognize that we have many children that struggle with a crisis after they've just come back from the hospital. I mean, if you look at the data on suicide attempts, on suicide deaths, many of those children had seen a physician or had been to a psychiatric facility within the past 30 days. And one of the things is, when she was talking about stigma, the stigma associated with not wanting to share with the school that my child has been out for a week because of this. And so a different group, the Alamo Area Teen Suicide Prevention Coalition, pulled together this back to home kind of handout that psychiatric facilities are passing out, school counselors are passing out. We're trying the police officers now have it, and it was part of the CIT training, to encourage families to share with others when their child has been to a psychiatric hospital, so that their transition back to campus is not just from 0 to 70. Does that make sense? That there's someone there to greet them, maybe to say, maybe lunch is right now, you can come eat in my office for lunch, so that it's not so overstimulating and you're not overwhelmed, and we can navigate that kind of bullying situation that maybe resulted in this, whatever the factor. And so I'm just really proud to be part of a community that's doing things above and beyond and trying to be creative in helping our children. Thank you for letting me speak. I appreciate it.
Thank you so much. And you're one of those, like you said, this isn't a juvenile probation initiative alone. And so we appreciate and recognize that you're also going above and beyond and making sure that kids have every opportunity to get the help they need before or during or after they might end up, with you and at your day job at juvenile probation. So thank you, Dr. von Stultz. Appreciate that. Do you want to go up the podium, or you want to take it from here? All right, go ahead, Jessica.
I'm on the very edge of the stage, so it's probably best if I just stay where I am for safety's sake.
We want to navigate youth mental health crisis. We don't want to have our own crisis.
Correct. We don't want to be calling 911. Okay. So I'm going to do a brief overview of who we are, but then speak specifically in how our crisis services and inpatient hospital fits into everything you've already heard today. So Clarity is a nonprofit here in San Antonio that's dedicated to treating kids ages 3 to 17. And we do that in a couple of different ways. We do have a acute and inpatient care, about to be 74 beds. We've got 8 new beds that are about to open, where kids come in crisis, and I'll talk in a little more detail about that. We also have a day hospital program where kids come during the day, go home in the evening, and then your traditional outpatient therapy and psychiatry services. But I want to focus on our crisis services area. So you've heard, you call 911, you call Center for Healthcare Services, maybe an emergency team comes out. We work really closely with these partners. This is where they would go. If the team went out there and the mental health clinician decided that there was imminent danger, there was something that was causing the need for immediate intervention. We are open 24 hours a day, 7 days a week. Law enforcement navigation was mentioned. If 911 is called, an officer might go out to the home. They might bring them to our crisis services area to do an assessment. So what happens once you get to us? We're going to do a safety assessment and basically going to be screening for, is a child a danger to themselves or to others? And that's really the criteria to come into the hospital. It's not always the need for a hospital stay. Sometimes we will get a law enforcement navigation or a referral from a team out in the community, and maybe they need that day hospital program, but everybody just needs a little break. We need a little respite. And so coming into crisis services, getting that assessment done allows us to get you connected to the appropriate services. We don't just get folks from these outlets. You can just walk into our services as well. I think when we're talking about that continuum of crisis, we don't want to wait till we have to call 911 when we're at that point. If there are warning signs or things we can pick up on here and get help, that's why we're just there. You don't have to call, you don't have to make an appointment, much like some of the services through CHCS. We want you to just reach out and get that assessment and let us help you get connected to the appropriate services. If it's not us, there are other services in town that do a similar job. San Antonio Behavioral Health and Laurel Ridge Treatment Center both have crisis assessment areas that are open 24 hours a day. There are other service lines for adults as well, such as Methodist Specialty and Transplant. But we want to just make sure folks know where they can go if they're at that point, that they do have crisis. There's sometimes confusion over what the role of the hospital is in that overall treatment. We are the tip of the tip of the tip of the iceberg is the best way I can explain it. We're really there to get the crisis dealt with and get a child connected back to the community. So we're really going to be resolving any thoughts of self-harm, thoughts of harming anybody else. As I mentioned, this is just a snapshot of one of our rooms. Kids stay about a week, and again, that focuses on crisis stabilization and safety and getting you connected back into, and we do that with a variety of groups, family therapy, individual therapy, medication management with a psychiatrist. And just a quick peek at some of our campus, we do try to show the kids some positives as well. We do have a pool, we've got a gym, we try and encourage them to get out and play and enjoy themselves, even though it's a very stressful situation, especially if you kind of started with law enforcement down here to end up needing an inpatient stay. And I know I went very quickly.
That's good. Thank you so much. And I want to thank Jessica publicly. So Clarity is a nonprofit hospital, and when she talked about opening 8 new beds, that was through fundraising efforts, which is, probably no one's favorite part of their job. But basically just you saw the increase in you saw the increase in 911 calls. We understand the increase in need in our community. And we've also had some really key mental health services closed down in our community over the last 5 years. And so just want to thank you for taking that on. You didn't have to expand, and you and your board didn't have to recognize that need, but you have, and if anyone wants to give Jessica any money, no, I'm just kidding. We'll let her.
Find me after if
Yeah.
you know any millionaires. We're
Yeah.
still
Yeah, if you know-
looking to expand outpatient. So yeah, find me.
Yeah, we'll pass the plate. No, but I really thank you for that, Jessica, because it is something that Clarity didn't have to do, but has done. And I really want to recognize that. So now we have a few minutes for questions. If anyone wants to come, please come up to the microphone. We are recording this, and so if you're on the microphone, your audio would be picked up that way. Go, come on. Go for it, right here.
No,
You got it.
Yes. Yes, so I do have I'm a mom of 3 kiddos. My son is now 14. We have been with Clarity starting from 2018 or so. Several inpatient and outpatient services. And one of the things I really, I guess we took from the way Clarity worked is it was really, I felt, patient, individual based. And the team deciding when you go from inpatient and step down to outpatient was based on the providers, the individuals who are on the ground working with the child. One of the main barriers I've come in across with the Center for Healthcare Services, specifically with the YES Youth Empowerment Services waiver, is we're getting some of these kiddos out of crisis. My son has not had to been hospitalized in the last 12 months, which is great. And so he's not at risk, he was at risk of out-of-home placement, things like that. So once we get to this determining lower level of care when it comes to using services through CHCS, the individuals determining that lower level of care are not the individuals on the ground with the families. And when you have, I feel a child or family saying, it's just kind of how can we kind of just get that model to kind of work with CHCS? Because right now, for my family, CHCS is our barrier, and HHSC.
Well, I'm sorry that you're feeling that we're a barrier. Definitely do not want, we want to make it easier for you, definitely not harder for you. Would just love to maybe talk to you after this, just privately, so I can get a little bit, probably it would be helpful if I could get a lot more information, I think, just to get some information from you, and then we can, definitely see, luckily, I'm glad you're here, and I'm glad you brought it up, because we just want to make sure that we're serving everybody the best way that we can serve them. So why don't you and I have a conversation after, if that's okay, and then I'll give you my information, and we can take it from there. Thank you.
Thank you for that. I know it's so hard to get people in the right services that really drive at the right times with people. And mental health services are so personalized, right? You want to connect with your clinician, with your psychiatrist, with your nurses and all of that. And so it can be a challenge, I know, to get in the right services. Anyone else have a question?
Can I add just one quick thing? I mentioned trying to get help before you get to crisis. I think we all know, everyone sitting up here, unfortunately, the easiest time to get services is when you're in crisis, because it does open a lot of doors, which is an unfortunate set of circumstances, because there is such a wait list for outpatient services and some of those upstream services. So I get why sometimes people, the first services they're getting are when they call for an assessment or when they walk into our crisis services. And so that's something as a community I think we need to continue talking about in terms of making those services more accessible instead of having to wait until we're in crisis.
Thank you. Go ahead.
For the CIT training that you were talking about, I'm going to put my school board trustee hat on for a minute. So I'm from the Austin area, Leander ISD, and we just hired our chief of police. We're, of course, now mandated by the state to have a school district PD or use marshals, because we have to have an armed guard in every single school. Thinking about the training that's coming ahead of us, is that training available statewide? Is it just in San Antonio? Maybe I could hook up with you and talk about, we want to make sure that our officers are trained well in mental health, because we know most of the time on campuses, those are going to be the situations they're going to be in.
It's a very good question. Just know that there is a version of CIT that's required. It's for TCOL certification. It's a 3-day. It's not youth specific, and it doesn't have the degree of role playing that we believe is beneficial. The SAPD also does a full week. We have been asked whether we would take our show on the road, and the answer is no. In part because there is value to it being a community-driven training. I am more than happy to share with you our schedule on what classes we do, and to talk to you about who to pull in, what agencies, so I'm free to do that. They're also welcome to come when we have classes in June and July. But know that we intentionally restrict, that sounds like a harsh word, to 7 per agency, because we want to always keep it open to as many agencies as possible. But that'd be 14, June and July. And then they'd come to San Antonio and do Six Flags when they're free.
Yeah, thank you for that. We're happy, we're really proud of our efforts here, and happy to share, especially, to our neighbors to the north. So thank you for coming. One more question?
Kind of a policy question. So I know we talk a lot about the intake and what we're dealing with them, but how are we tracking outcomes, and how are we, because I feel like when I've been involved with this stuff, there's not a lot of, okay, what happens when our son graduates from the YES program? Do you track, it seems like there's a real emphasis on the crisis part, but we don't know what happens to that young lady that had, the experience. Where did she end up? How is she doing now? What other things have happened from when that officer had that interaction to today?
Yeah, I can answer that question. So it's incredibly difficult to track the outcomes that you're talking about because of HIPAA and data sharing. So we're talking about people's individualized medical care, and if you're looking here, we're talking about it at maybe 3 different HIPAA-protected agencies: a hospital, juvenile probation, and CHCS. And then the police department has a totally different way that they can do rules around data sharing. We are working really well and really closely together through an organization called STRAC, where we do have an organized healthcare arrangement where we can do some data sharing. That's very technical. But what I'm trying to get at is that we're just getting into the point where we're trying to get into where we can track outcomes on the person level. What happens when the same person is not just going to Clarity multiple times, but is also going to Laurel Ridge multiple times, CHCS, is getting classroom-based services through Communities and Schools, through Family Service Association, and then maybe goes to the CHOSA ER, sometimes for medical care. And so we are beginning to look at that and trying to look at outcomes. We're trying to understand how we can best serve these adults and the kids. We serve them differently. They have different resources for them, but it's definitely something, it's the dream, and I think we are going that way, but because of data sharing, because of HIPAA and privacy, it is hard, but it's definitely something that we want to pay close attention to, and we're working on very closely.
One big component of a huge component of our crisis response team. So if we respond to a crisis, whether it's our MCOT team, our CMOT team, one of our multidisciplinary teams, we have follow-up after that. So we do a 24-hour follow-up, we do a 7-day follow-up, and then in the case of some of our MDRTs, 30, 60, and 90 days. And with the point of those follow-ups is kind of sort of your point, just to make sure that, okay, maybe the crisis is over per se, but now maybe the real work is beginning, and now we need to really figure out, okay, well, now what? Where does this person need to go? What is the best path, and what is going to serve them well? And how can we get them connected and engaged in services to prevent another crisis, so that they're going to know what's going to happen, so that the family also knows really what to do, or warning signs to look for, like we talked about a little bit earlier, that they can kind of cue in on. And to Jessica's point, to get at, just so we can be here instead of waiting till we get to DEFCON level. So I think the follow-up components, and we all work really hard on that together, is a really essential element.
So, and for the CIT training, I forgot to mention that we do require that the officers pass a written test at the end of the course and a role play test. So they're graded, like when got my daughter again, he had to pass the test when he was, but we also follow up. So the trainings are in the summer, we follow up in October, and they do a pre-test and a post-test in regards to the percentages of kids that are taken to detention versus psychiatric hospitals versus released back home to their family. And we, normally pre-test the two top options for where they send people, or the detention center or the emergency room. And then in October, the two top options are psychiatric hospital and family kin. And so we do that every year, and the results are consistent across every year. So that's, for those first responders, at least we know that at least the kids are getting connected to appropriate care, not criminalizing their behavior.
All right, everyone, thank you so much. We're at time. Our next session, if you want to stay, is Navigating Youth Substance Use Services. So thank you for your time and sharing it with us today.